2.5%. Our average daily cases rose from 400 on average daily last week to now over 700. And currently we have 454 members in our community who are hospitalized, with 69 of them in the ICU. And as you may have heard from CDPH, everyone in the country and in the state is taking this very seriously because of significant rise in the hospitalizations. And so there have been 2 public health state orders encouraging healthcare workers to get vaccinated, and for anyone who is visiting in the acute care facilities or in our long-term care facilities, the recommendation is for anyone desiring to meet their family indoors to wear a mask if they are not vaccinated and show proof of vaccination.
Dr. CK, just to give some context, today we reported 1,108 positive cases. And that is as I understand it, the highest daily positivity count since January 31st of 2021. Is that right?
Correct.
Okay, and then we now have the highest hospitalizations and ICU patients since February 25th of 2021. So we're definitely not going in the right direction. Is that right?
Yes, we are not going in the right direction, but what we do know is that the majority of the hospitalizations are amongst those who are unvaccinated. And we know there are many in our community who are not yet eligible to get vaccinated. And so it's really up to everyone as a whole to take precaution. And if you are eligible we're encouraging you to get vaccinated, or at least to get fully vaccinated as soon as possible.
Okay, and just to share with the public some who may not know, it's free to get vaccinated, correct?
Correct.
And even though we don't have the super pods, we have clinics all around Orange County.
Yes, we have clinics all over Orange County. You can go on myturn.ca.gov. You can also call our hotline number that's on our website. You can go on Othina. You can go to your local pharmacies. Most large retail pharmacies are actually carrying the vaccine. And some of the primary care clinics are now carrying the vaccine as well. So there's plenty of choices to get vaccinated. So please get vaccinated if you have not already.
Okay, and can you talk to us about children? Because what I'm alarmed by are the numbers of children that are starting to get hospitalized and testing positive for COVID, which is very different than what we've been seeing over the last 16 months. Can you talk to us about what's happening with children?
Right, we know that children, especially those under 12, are not yet eligible. So we know that there's a significant portion in the young population who is not vaccinated. And so they're at highest risk, especially with this Delta variant that's highly transmissible. We do have cases that are hospitalized, as with many other states that you've been hearing. The rates of hospitalization for kids is still low, but it is happening.
Okay, so as I understand it from our office reaching out to Chalk Hospital, we have 110 children that have tested positive for COVID. Is that right?
Correct. And we currently have 8 hospitalized.
8 children hospitalized. And do we know whether we don't know their ages at this time, right?
Right now, I don't know their age status, nor do I know their vaccination status. I do know from our summary from July, there were a total of 11 children who were hospitalized, and all of them were unvaccinated.
Okay. Okay, so what can families do to protect their children?
If you have children who are not yet fully vaccinated, or or partially vaccinated and not fully vaccinated, even if you as a parent are vaccinated, you need to take precaution. When you're out in outdoor public settings or crowded settings, wear your mask, or try to avoid those busy, group settings. If you're going to work, or you're again in close contact with other people who may be at risk, it's really a good idea to take precaution for yourself as well as your loved ones. Because what we're hearing throughout the nation is that, yes, vaccines are very effective. They effectively have reduced hospitalizations, and that's why we're not experiencing as high as the hospitalization rate as we were expecting, although it is still high. But, everything that you can do to prevent yourself from catching COVID is going to be helpful. So breakthrough cases are still happening. They are low in those who are vaccinated. And the problem we have right now is if you have a breakthrough case and you're not careful, you can actually spread COVID to others around you. And that's the dangerous piece, because most people who are vaccinated will mildly have symptoms or no symptoms at all. And so if you don't know that you're carrying it, you could potentially transmit it to someone who's not vaccinated or who is at risk.
Okay. And yesterday on our call with the healthcare providers, they also were very strongly encouraging even those who are vaccinated to wear the mask because of what you just said, that it's like you're going out in the rain. The vaccination is your umbrella, and the mask is your raincoat when the rain starts pouring harder. And so that's why they're encouraging us all to wear our masks, even though we're vaccinated. I'm fully vaccinated. In our office, we're wearing our masks. And so anything else you want to share with the community about some of the county procedures or what's happening in Orange County as it relates to protection against COVID-19?
So just a reminder that for those who are not yet fully vaccinated or not vaccinated at all, you are required when you go into public indoor settings to wear a mask. For those who are fully vaccinated, it is strongly recommended to wear a mask. It's up to businesses to decide for themselves if they want to fully verify any members who are entering their business to either mask up or show verification at this time.
Okay, thank you. So at this time, I want to open it up for any questions. And what we'll do is if you could type your name in the chat, and then our office will call on individuals to answer questions at this time. So
okay, it looks like we have our first question from Hassam.
Hello, thank you for taking. I was curious, is there a concern that the Delta variant will start to spread quicker when the fall semester starts for students? In what ways is the county working with school districts to ensure that that spread doesn't happen? And when will children under the age of 12 be eligible for the vaccine?
Thank you for that question. Right now, as we know, we do not have EUA authorization for vaccinations for those who are under 12, but we expect it probably after September, hopefully sooner, but it's most likely going to be later in the fall. As far as what we're doing in terms of recommendations for schools, we're just following what the California Department of Public Health has put out in terms of recommendations for schools, where we're going to have so California Department of Public Health is recommending that there's universal masking is utilized in the schools to prevent further transmission, and that continued close contact monitoring occurs, and testing occurs obviously for those who do get infected or are in close contact.
okay, next question.
Next we have Spencer Custodio from Voice of OC.
Hi, thanks for taking our questions and holding this news conference. My question has to do with masks and vaccines. Is the county considering reinstating a mask mandate, a universal mask mandate, similar to like Los Angeles County for, indoor places, regardless of vaccine status? And is there any consideration to have, the county workers, similar to what Newsom did with state workers, either submit to a weekly testing program or verify that they're fully vaccinated?
So the California Public Health order came in and was updated yesterday, encouraging all or requiring all health professionals to show verification of their vaccination status and complete their vaccination status by September 30th. So all health professionals in the hospital systems and the outpatient clinics will have to follow that guidance. And the county is taking the same action when it comes to our providers and our staff who are in health facilities and delivering care.
Dr. CK, that would include elder care facilities, homeless shelters, any types of group homes, is that correct?
So this is for healthcare facilities. I know that there's still a lot of questions and we're trying to get more clarity, but definitely for the long-term care facilities, skilled nursing facilities, hospitals, rehab centers, outpatient clinics, all of those are required now by the state to have their staff members who are in contact with patients to show full verification of vaccination. And if they have exemptions, that they will then be tested on a regular basis, depending on the site that they're at.
Thank you. Okay, next question.
Next, we have Alicia Robinson from the OC Register.
Hi, thanks for taking questions. I just wanted to ask about vaccinations and what we're seeing on a daily basis as far as, are we starting to see more people wanting to come and get vaccinated now that we're seeing cases rise? Obviously in the spring, once vaccines became widely available and more people became eligible, people were clamoring to get appointments. And then over the last few months, we saw that fall off pretty dramatically. So what's happening right now as far as demand for vaccinations?
In terms of the overall look at the numbers, we are at least at a plateau. We were on a downward trend leading up to the last 2 weeks, but over the last 2 weeks, we now have a plateau, which is encouraging because that means that people are getting vaccinated. And when I talk to the members of our team who are still vaccinating at mobile pods, they are all saying that they see a rise in people wanting to get vaccinated. So we are seeing a rise, but when we actually look at the overall numbers for the county, we're plateaued with a regular number of cases getting vaccinated on a daily basis.
Okay, if you have a question, please put your name in the chat and we'll call on you for the question. One other question I'm going to ask Dr. CK, can you give us some insights into, of the people who are hospitalized, not just children, but other residents, what percentage are unvaccinated at this time?
Over 90% are unvaccinated.
Okay, I don't see any other questions in the chat or any other names. So at this time, we will close up this conference. We hope that's been helpful. We want to try to make sure that the public knows that this is very serious. The Delta variant is taking us backwards, and all the progress that we have made is kind of taking us backwards in terms of the public health. Now, Dr. CK, there is no plan for us to do any kind of a shutdown or closure of businesses. At this time, we're just really imploring everyone to get vaccinated. Is that right?
Correct. There is no mandate when it comes to masking or closure. Right now, we are closely monitoring our hospital capacities and our numbers. So we're just hopeful that everybody in the community who is eligible immediately tries to get vaccinated. And if you are not able to get the vaccine or you're not eligible, that those around you and you yourself should take precaution to prevent yourself from getting COVID.
Okay. All right. Thank you so much. And thank you everyone for tuning in.
Thank you.